In this video, we're going to talk about the predictors of difficult intubation. So there are several, there are about 8 that we are going to discuss and cover. And because there are 8, it might be difficult to keep them all in line and in check. So what I like to do is I like to separate them into 3 categories. So I'll go 1 here, 2, 3, 4, 5, 6, 7, and 8. All right, and we'll get into the 3 categories in a second here. The first predictor of a difficult intubation that we're going to cover is a prior history of a difficult intubation. So this category is going to be our history portion. Now we're going to move on to this next category. This next category can be categorized by how well we can open our mouth opening. So right over here, our second predictor of a difficult intubation that we're going to cover in our mouth opening category here is the inability to pronath. Now, what does this mean? So this basically means the inability to bite your upper lip with your lower teeth or your lower front teeth. So this has to do with examining the patient's mouth, examining the patient's teeth. The third predictor of a difficult intubation is less than 3 centimeters between your incisors. So this is an assessment of how well you can open your mouth. Your incisors are your front teeth, your front lower and front upper teeth. And if you don't have that much space in between them, you have poor mouth opening. It might be more difficult to get a blade in there. And that contributes to our difficult intubation predictor. The fourth predictor that we're going to cover is a non-compliant mandibular space. Non-compliant mandibular space. So this is in patients who have TMJ, they have poor mouth opening, they have a really tight jaw. This is essentially going to contribute to a difficult intubation, to the possibility of a difficult intubation. And again, it's because you can't really open your mouth. The fifth predictor of our difficult intubation is a Mallampati class 3 or 4. Mallampati 3 or 4. We'll have a separate video on Mallampati classes and the Mallampati classification system. But essentially what it is it's the standard for assessing the relationship of tongue size relative to the oral cavity. So what you do is you ask the patient in a sitting position to open their mouth and stick out their tongue. And by identifying structures or not identifying structures, you can get an assessment of ease of intubation. Now, one thing to note is that Mallampati score has a poor positive predictive value for predicting a difficult intubation or ease of intubation if used alone. So that's why we use the Mallampati scoring system with other factors. But a Mallampati class 3 or a 4, for the purposes of this video, it basically means that you cannot see the uvula. So cannot visualize uvula. And I know that there are other components of the Mallampati scoring system, but an easy way to break it down is if you see the full uvula, that's Mallampati 1. If you see partial uvula, that's Mallampati 2. If you don't see the uvula, that is a 3 or a 4, and then you look to see if you can see the soft palate to delineate 3 or 4. But not being able to visualize the uvula is a Mallampati 3 or a 4. So that's our mouth opening category. And then lastly here, the last 3 that we're going to cover is our neck category. So the next predictor of a difficult intubation is a thyromental distance less than 3 finger breaths. Thyromental distance less than 3 finger breaths. So what does this mean? The thyromental distance is the distance from your mentum or your chin to your thyroid cartilage. And this is when your neck is extended. So more specifically, it's from the distance from the chin to the top of the notch of the thyroid cartilage, and that is during neck extension. So less than 3, and if you can stack your 3 fingers in between that, then that is a predictor of you have more ease of intubation. If you have less than 3 finger breaths, then that is a predictor of a difficult intubation. Number 7 is going to be a thick neck size. Shall right here, thick neck. And typically that is a circumference of greater than 40 centimeter circumference. Sorry, my handwriting there is pretty small. So a thick neck means that you have excess tissue. You have excess tissue in the airway. It might be more difficult to intubate. And our last predictor is limited neck and head range of motion. Limited, we'll say head and neck range of motion. The way that we intubate is we keep the lower neck flexed and the upper neck extended. And in patients who have a more difficult range of motion or a limited range of motion, it is more challenging to get visualization and intubate. So this is our neck category. So again, to summarize, we can predict our difficult intubation. There are a lot of these predictors. You can separate them by history, mouth opening abilities, and the neck category. So we have prior history, our mouth opening, inability to pronath. If we can't open our mouth, we have a low incisor distance. If we have a non-compliant mandibular space, and if our Mallampati score is 3 or a 4. From a neck category, if we have a thyromental, a chin to the thyroid cartilage distance of less than 3 finger breaths, if our neck is thick and greater than 40 centimeter circumference, and if we have limited head and neck range of motion.